16-year-old. So
Your what? I'm sorry.
I had a 16-year-old Pomeranian that I lost, that we put down about 2 weeks ago.
Oh, okay.
So that's in a roundabout way how I found this group. So
Wow. Wow.
here I am. Yeah.
Oh, good. Well, we're glad you're here.
Well,
Yeah,
thank
really
you.
glad you're here.
I'm excited. I'm excited. Lots to
Welcome.
learn. So
Yes, lots to learn.
Yeah.
Hi, Dr. Thomas.
Well, hello. I'm
Hello.
trying to figure out
Hi,
who
Meg.
this person is that just joined us with this bizarre name.
Looks like Megan.
And I know, that's why I'm confused.
Oh, that's my spiritual name.
Oh, that's your spiritual name.
Wow.
Yeah.
Okay. Okay. That explains it. I'm going to have to come up with a spiritual name for Jonna
Yeah.
and a spiritual name for Sabrina too.
Hi, Sabrina.
Breathe.
Oh my goodness.
Oh God. How are you ladies?
Good.
Everybody doing okay? Hi April. I'm Dr. Thomas. Nice to meet you.
hi.
Nice to see you. Hi.
It's so nice to finally meet you.
One of
I
our
love-
rules is that you can't eat in front of us without sharing. So
Well, I'm a rule breaker, so
Okay.
sorry.
You're gonna
You're
fit
welcome.
right in.
I'm glad you joined us. Hey Leslie,
Hi.
you guys getting a break up there? Weather?
Well, it comes and goes. We've had a couple days, like hasn't been cold, but it's been foggy and freezing rain, and it's just, yeah, who knows?
That's better than
I don't
30
know,
below.
but
Better than 30 below.
oh gosh, yes. We haven't had any of that since whenever that was, back in January. It was so cold,
Yeah.
and we haven't had anything that cold. It's just we've had lots of snow and whatnot. But I have not been out of the house. Like, I'm in next week, I get to go back and see my surgeon and hopefully start my physio and get moving around. But I literally have been in my house for almost 2 months now, except for one day when I went back for my first checkup. So
Hope you're
I'm just
taking your vitamin D.
yeah, yes, yeah, and I'm going to spend so much time outdoors. I don't care if it's warm, cold, rainy, windy, whatever. I'm just going to be out there when I can.
Well, okay. So April, where do you live?
I'm in Salt Lake City, Utah.
Okay.
So
They drive
it's
through
really
there
cool
quite
to-
frequently. Yeah.
You have?
Oh yeah, gosh, yeah. Yeah.
Are you a skier or? that's
No, I
usually
said
what-
I drive through there. I used to go
Oh.
I live in Spokane, Washington, and I used to go down
Mhm.
Sedona every winter and
Okay.
spend some time down there.
Yeah,
So
so
I
you
drive
can
through
do
Salt
that
Lake
here.
going down there. Yeah.
Yeah.
Ooh, we're coming to Park City next month to ski.
Oh, that is, I love. I'm about 20 minutes away from Park City. I live just on the other, we live on two ends of Parley's Canyon, and I'm just right at the mouth of the canyon. So it's
Hmm.
beautiful. Have you been there before?
Never.
Uh,
Looking forward to
love,
it.
love the Wasatch Mountains. Born and raised here, right here in the mountains. I love
Oh,
them.
how nice. Can't wait to see it.
Well, hi Melissa.
Hey, Dr. Thomas.
How are you doing?
I'm doing pretty good. How about you all? Hi, Leslie, Jonah.
Hi.
Nice to see you, April, Sabrina.
Hi.
Okay. Have I said hi to everybody except for Sabrina?
I felt it.
You felt well, hi Sabrina.
Hi.
Hi,
everybody.
Sabrina.
Hi, everyone.
All right.
Sorry
Well,
for all my messages.
we'll give it a couple more minutes before we get started. I imagine Jolynn will show up and no telling who else.
She's always late though. Can't wait for her.
Anna said she was going to be late.
Who did?
Anna.
yeah.
Anna,
Yeah. She's always late too. Who has that beautiful swimming pool?
I know. That's what I'm looking at.
That's
Oh, I'm so
Satya.
jealous.
That's Satya's spiritual pool.
Oh, namaste. Oh, no, that looks really nice.
That looks
Yeah,
nice.
well,
Where do
we're
you
all-
live, Megan?
In Las Vegas.
Oh,
Oh,
okay.
oh.
Wow.
Yeah. But it's,
Yeah.
you know, it's
Oh,
been
we're
pretty
shoveling
cold here
snow.
too.
She's out laying by the pool.
Go ahead.
And hi, Hi,
I said,
Megan. I
while we're
didn't say hi
shoveling
to
snow,
you.
you're out lying by the pool.
Yeah, you
I
can.
was
Yeah.
thrown off by that.
Yeah.
All right. Well, I know you two guys want to talk about lab results. And I will say that I had a really busy day and I didn't finish appointments until a little after 4. So all I had to do is had a chance was to glance at those numbers. And I'll go back over them probably in the morning and then go into detail with it. But
That's okay.
I did look at them. So Jonna, what I saw, and again, I just looked over the numbers and I got some impressions and I don't remember specific numbers, but it looked to me like the kidney numbers were sneaking up a little bit.
Yeah,
And-
they all are.
And the T4 was still up around 5 or something.
Hmm.
Guess the thing that concerned me most was the urea nitrogen levels were pretty high.
What is that
The-
called?
The BUN.
Oh, the BUN. Yeah, I know.
Do you have that in
This-
front of you? Was it like
I
7?
do. I do. I think it was 63,
Yeah, yeah.
66. Yeah, and it was 43 last month, like 2 months ago.
Okay. So I know we've talked about a lot of lab results over the years, and I know we've talked about kidney function and what have you, but does everybody know what the BUN is? Blood urea nitrogen? Everybody remember that?
I forget.
Sort of, yeah.
Yeah.
Yeah, I
It's
forget.
usually one of the things that we monitor with patients with kidney disease. It's a byproduct of protein metabolism. And so the urea byproduct should be excreted by the kidney. And so that should be within normal. And when the kidneys start to have some problems, then they're not eliminating the urea like it's supposed to. So it starts to back up in the bloodstream. So we see that as an elevated BUN. And the reason that's clinically significant when we monitor it is because that number is what usually makes the patient feel bad. Okay. In other words, the creatinine can be up, the phosphorus, all this can be up, but the urea nitrogen, that is a toxin. And so that's a reflection that the kidneys aren't getting rid of its own impurities. And so that those toxic levels start building up. And that's when the patient starts feeling badly. They get nauseated. We call that auto intoxication. So when we're monitoring kidney patients, in other words, if I get somebody calls me and they've got a dog or cat with chronic kidney disease and say, my dog has gone off of its food, then usually that suggests that the urea nitrogen levels are climbing up, and because they're sick. You see what I mean? They're not feeling well.
Yeah,
It's usually
yeah.
that. And so the best way, generally speaking, if you have a patient with chronic kidney disease, the best way to deal with that is to be given subcutaneous fluids. Okay.
Yeah.
Because what that's doing is that's supporting the kidneys to increase the blood flow to the kidneys. And what that does is that supplies more oxygen and nutrition to the kidneys for cellular function, but it also flushes those toxins out. So when you give subcutaneous fluids at home, then you're going to be lowering that urea nitrogen level down, and that's going to make your pet feel better.
Wow.
How
So
often?
that's, as needed. So some patients, and I bet I've got probably 30, 35 patients that are chronic kidney disease that I'm working with now. And so if I've got some that are getting sub-Q fluids every day. I've got some that are giving it every other day, some that are giving it every third day. Just depends on how bad their numbers are, how bad they're feeling, and stuff like that. But usually if the urea nitrogen levels climb up, then they start going off their food. And so that's when we talk about blood work versus clinical symptoms, when I've got a patient with kidney disease and it's usually what you're seeing clinically, you can expect to see it in their blood work. Okay, you see what I mean? If they're starting to go off their food, but yet they're still moving around and they're not vomiting and stuff like that, then urea nitrogen usually climbing up. If they crash on you and they're not eating, they're not drinking, they don't want to get out of bed, then that usually, if you do blood work, it's going to say that everything's going up. You see, So
Right.
it's kind of like the blood work is going to reflect what you're seeing clinically. And
Yeah.
so with your situation, John, and we've talked about this since day one, is that you're juggling between the kidney disease and the hyperthyroidism. And so it's kind of like, if you make a case for the primary problem being hyperthyroidism, then you sit there and say, well, we got to get those numbers down because the blood, the heart's going to be pumping too much, and and then you could get some increased blood pressure to the kidneys, and that could cause some damage, et cetera, et cetera. And on the other hand, you've got the scenario with the kidney disease that says, hey, if I push that blood down too quickly, then I'm going to stop perfusing the kidneys, and then that's going to push the kidneys. So it's kind of a balancing act. And that's why we try to use some alternative things, again, with the herbs, with acupuncture points and stuff like that to try to get it, deal with the imbalances that are creating both of those. But in your situation, what my gut told me when I looked at it was probably needs some sub-Q fluids. And it's kind of a shame that they hindsight's 2020, but when he was in the hospital the other day getting the blood work, we would have known that they could have given him some sub-Q fluids at the time.
I had the conversation. So before I went in, I contacted the cardiologist last week and said, my doctor has said no sub-Q. What do you think? And she said, consider low volume, such as 50 to 70 a day, then recheck echo a month later to see if the size of the left atrial. So she said the HCM was mild and there was no left atrial dilation. So she's not feeling like it's that bad.
Yeah.
And so he said, we can do some, but I don't know if that's a good candidate because he, may not like it. And of course, I mean,
Well, and I've been, you guys know this. I've been doing this a long time. And I've treated thousands of cats and had people treat thousands of cats at home with sub-Q fluids, and a lot of them with heart murmurs and stuff like that. I've never, ever, not only have I never seen one, but I've never heard of anyone giving sub-Q fluids at the correct dosage that did stress on the heart. Because it's kind of like this scenario that when you think about giving fluids under the skin, okay, then how is that fluid, you're giving it between the skin and the muscle, and so how is that fluid picked up and how does it get into the vascular system? It's picked up by those little bitty capillaries, those little bitty vessels that are in the subcutaneous tissue, okay, and they're really sparse in there. That's why you can cut your skin and even go all the way through the skin and you're not going to bleed to death because there's not any major vessels there. You see what I mean? So you got a very little blood supply in that subcutaneous space. Okay, so you have these little bitty capillaries in there, and if you have a heart now, and remember these capillaries are all relying on blood perfusion, the heart pumping enough blood to get blood out to these capillaries. Okay. So if you have a heart that's not functioning well, then those capillaries are going to be very, very insignificant, okay, almost non-functional. So what happens when you give a patient sub-Q fluids that's got a bad heart? That fluid just sits there. You see what I mean? Because there's not enough of those capillaries to pick that fluid up and get it into the system. Okay, so it's almost like a self-protecting scenario. If the heart's so bad that you're going to overload it with the fluids, it's not going to pick it up in the first place.
Okay.
You see what I mean? Now, and if there's enough blood in the if there's enough blood in the vessels in the subcutaneous to pick the fluids up, then that means the heart's perfusing enough to be able to do its job. You see what I mean? So in my opinion, it's you read about that potential there, but again, I've only ever seen one patient ever that was overloaded with fluids that stressed the heart, and that was by giving IV fluids, which you can because you're pushing it. You see what I mean? You're not depending on the body to absorb it. You see what I mean? Big,
Yeah.
And the thing about it is, if you've got a cat or a dog that's got chronic kidney disease and those numbers start going up and you don't do anything about it, or we don't do anything about it, then then that patient's more than likely going to continue to get worse, end up in the hospital. And what are they going to do? The first thing they're going to do is they're going to start giving IV fluids. Otherwise, the kidneys are going to fail. You see?
Wow.
And so
Yeah.
then they go in there and all of a sudden now you got a cat in acute renal crisis and they're going, oh my God, we got to support these kidneys. And so we've got to give IV fluids, but we got a cat here that's got mild signs of cardiomyopathy. So they're sitting there going, oh my God, we got to be careful. We got to monitor, but they don't have any choice. They've got to get the IV fluids or the cat's going to die. You see? So why do we wait? We don't, and it's crazy too. It's crazy too.
Yeah.
Well, if he were mine, I would be giving him fluids and I'd be giving him 10 cc's per pound of body weight, even if you have to do it once or twice a week. I talked to a lady on the phone today and she's got a dog and she gets it once a week. So, you know, but it would help push that urea nitrogen level down. It would make him feel better, pick his appetite up. Because what else does the urea nitrogen level do? Not only does it make them feel bad, makes them feel auto-intoxicated, but it also causes erosions in the stomach wall. Okay.
Oh.
And so they're going to start getting this inflammatory gastritis that leads to erosions. And that's why a lot of patients that have kidney disease are put on antacids and stuff like that to curtail that nausea that's associated with that. And so to sit there and say, I'm not going to give sub-Q fluids in the event that could stress the heart, but we're going to allow this slow deterioration to continue and get worse and worse. And then all of a sudden we got a crisis. It just doesn't make any sense at all. And I just hear too many people say, oh, they said don't give fluids because my dog's got a murmur. And it's like, that doesn't mean, just because your dog's got a murmur doesn't mean that your dog's got a non-functioning heart. You know, there's a lot of patients that have heart murmurs out there that live their whole life and
Yeah.
with heart murmur and it never affects the function, you know.
Yeah.
So we have to use a little common sense there and say, if we choose to go this route, what are we going to end up with? Because you see, first thing that you said, John, is the numbers are going up. And unless we do something more, then they're going to continue to go up. And then pretty soon he's going to feel really bad. And then you're going to be running him down to the hospital.
I
Okay.
have a question. This is Jolene.
Who's,
Hi, everyone.
that we don't have any
Jolene.
Jolene in our group.
You have a very important person named Jolene.
All right.
Very, April, did you hear that? Jolene, very important person in our group. Keep that in mind. So before we go to you, Jonna,
Well,
are you okay with
it was
where
about
we are
the
now?
heart murmur thing.
Do what? Go ahead,
Well, it
Jolene.
was when you were talking about sub-Q fluids with the pet with a heart murmur. And
Right.
So we're going to get sub-Q fluids to a pet with a heart murmur. What do we watch out for? Because I hear it, read numerous times that vet said, don't be careful with the heart murmur. So if we give the sub-Q fluids, what should we watch out for to know if our pet is going into distress or in a dangerous place?
Okay, if there was cardiac overload, which again, in 42 years of practice, I've never seen it. I've never even heard of it. But if you did cardiac, like the one that I saw at the emergency room that they did, and it was just an error that the technician set the perfusion pump too high. And so the dog got the fluids too fast and it did cardiac overload. And then what happens? The lungs start to fill with fluid. They get pulmonary congestion, start coughing.
So that shouldn't be an issue if we're just doing at home.
No, not
Sub-Q.
giving sub-Q fluids. Remember, there's a big difference between somebody saying, hey, your dog's got a heart murmur versus your dog's got heart disease. You know what I mean? It's got a problem with its heart functioning. Okay, let's say you've got a 6-year-old dog and you go to the vet for an annual exam. And we talked about this before, and the vet says, oh, did you know your dog's got a heart murmur? And you go, no, didn't know that. Yeah, it's got and so the vet listens and says, well, it's a grade 2 systolic murmur. So what we're going to do is we're going to make a note in the medical chart. And so we're not going to do anything. The heart's functioning perfectly normal now. It's just got a mild And what it means is is the mitral valve's got a little leak to it. So we have some valvular regurgitation. So we're going to make a note of that grade 2 systolic murmur so that every time you come in, we're going to listen to it again to see if it progresses. Okay. But we're going to send you out of the door. Why? Because one, we don't have anything to treat it. And two, the heart's functioning just fine. You see, my brother, who's 67 years old right now, he's had a grade 2 heart murmur his whole life since he was a boy. And it's never affected his function. And so heart murmurs it is a pathology, but the heart's still doing its job. It's just like kidney disease. Okay. You got some kidneys that are early kidney disease, but they're still doing their job. They're still doing their job. You see, and that's what happens. We've got to do the old cost benefit analysis. And John's is a perfect case. If we don't do something to help Rhett, in addition to what we're doing right now, then those numbers are going to continue to go up, and then he's going to crash on her and go into an acute, what we call an acute renal crisis. And then they're going to be really, really stressed in knowing they've got a cat that's got early cardiomyopathy, and now they're going to have to give IV fluids to save the cat's life. You see what I mean? We don't want that to happen. So we want to try to prevent that by going ahead and giving subQ fluids now and supporting the kidneys and trying to prevent that from happening. You see where I'm going with this is cost benefit analysis. And believe me, like I said, I wouldn't have any reservations if Rhett were my cat given subQ fluids at home. Again, standard dosage, 10 cc's per pound of body weight. And so 10 pounds are going to get 100 cc's.
Okay, he weighs 12 pounds, and the cardiologist, he has HCM. So she said 50 to 70, and the vet's going, that's not enough to make a difference, but obviously it is, right?
It is. That was kind of a foolish thing, but yeah, what she's saying, well, we'd sure like to give it 120, but I'd feel a whole lot safer with 50 to 70. And that's because she's the cardiologist. If she was an internal medicine person, she'd be saying, I'm more concerned about the kidneys than I am the heart.
Yeah,
I mean, you're talking to the heart person. And
Right.
so if you're talking to the kidney person, she'd be saying, hey, no, we gotta help those kidneys,
Okay.
so again, I would say 70 minimum, but yes, certainly will help.
Okay,
Yeah.
thank you.
And they can show they can show us how to do that at home. Like this is
Sure,
just new to me.
sure.
I just
Most
didn't
people-
know.
Most people do it at home. Yeah.
Okay.
Easier on the pet, you don't have to take them to the vet, and it's less expensive.
You can buy like the fluid and
Yeah,
Alright.
like the lady I talked to today,
Has to
that's
be
what
prescribed.
they told her, bring your dog in and we'll give the fluids and we'll show you how to do it, and then we'll send home the fluids with you. That's what
Okay.
most vets do.
that's good to know. I don't have that issue, but I mean, I have 2 dogs with heart murmurs, but because they're 14, 15, but
So what are you
I'm
doing for the
kidding.
heart murmurs?
I'm giving them hawthorn berry supplement. But is there more? And I don't mean to actually take it away from.
That's
No,
okay,
no,
honey.
but
I
I'm
said
glad,
that
I'm
one
glad.
way
That's
another
why
time.
we're having this
Thank you.
discussion, but yeah.
I had one more question on kidneys before we leave. When you mentioned the urea nitrogen level going high, I'm looking at one of my sample blood works. What is the line item? The
What is the what?
acronym,
Bun,
you're- you
it's
said-
the bun.
The BUN.
the bun. Oh, okay. Thank you. I'm done.
Okay.
And Dr. T, Melissa's, I'm sorry, I'm not trying to cut Melissa off, but while you're on the kidney topic,
Yeah, for sure.
because I think everything you just said about John, I think applies to Chloe, right? I mean,
Yes.
literally the
Yes,
same.
yes.
Okay.
The
Well-
only thing, I tell you what, we're going to come back to you, Melissa, because
Oh, that's okay.
because hers is pretty sick. The blood work that I looked at suggested that we're getting some early kidney disease. Okay. And the thing that was a little bit, again, I don't have the numbers. Do you have the numbers in front of you?
Yeah, I do.
What was the creatinine?
1.6
And high normal for that lab was 1.9?
was high 1.5.
Okay,
So
so
it's just a
1.6.
tiny bit.
Yeah, okay. And the
And then
urea
the
nitrogen, the bun was what?
yeah, the bun was 41 and their range is 9 to 31.
Okay. The significant thing is the creatinine elevation. Now, they did an SDMA too. What was it?
What's the SDMA?
It
Oh, it
was
says
something like,
SDMA is within the reference interval and creatine is increased.
yeah,
Can
but you'll see an SDMA number. I think it was like 10 or something. You'll see it on the list. It should be up at the top.
is it
I,
called
I know, I know I saw it.
shoot glucose? Oh, sorry. It's 13.
13.
And the high is 14.
14, yeah. Okay, so that's a little extraordinary because the SDMA usually goes up before the creatinine does. Okay, and if you looked at that and it says down at the bottom, it says SDMA is normal, but creatinine's elevated. The first thing that it said is it could be due to lab error. You see that? It's most of the time when you have an elevated creatinine and a normal SDMA, that means that the machine read it incorrectly, and it's usually due to what we call hemolysis, where the blood cells were broken down because we
Yeah, it says that.
handled it too rough. Yeah. So we get that's one thing that a lot of vets miss. They see that SDMA and they go, oh, it's normal, and but they don't look and make sure that there's not the potential for a lab error. So that number is an erroneous number, and that's unfortunate because you don't have anything to compare that to down the road. You see, so but we do know, and just for those of you that haven't heard this, when you have a patient with kidney disease, the gold standard for monitoring, even when we started grading kidney disease, has always been the creatinine levels. Okay, because the creatinine level is mostly influenced by the kidney. Very, very little other things can cause creatinine to be elevated. Urea nitrogen levels, phosphorus, those other can be elevated due to other things. So we've always focused on the creatinine. The problem with that is that the creatinine doesn't start to elevate at all until about 75% of the kidney is sick. Okay. So if you've got elevation at all in the creatinine, that means your patient's working on 25% or less of kidney viable kidney function. Okay. So which means, oh my gosh, we got to do something here. Now the SDMA, they started doing that lab test about 8 years ago. That will pick up kidney disease as early as 10% sick. So big difference between 10 and 75. You see, so a lot of times we get these dogs that come in and their SDMA is 17 and the creatinine is still normal. So that tells us, okay, boom, we got a dog here that's got early kidney disease. Let's do something about it now before the creatinine elevates. You see, and so, but until we started doing SDMA, we had to rely on that. Now, if she would have been my patient and I would have got those numbers back, the very next thing that we do is say, okay, we need a urinalysis out of her.
That's what they said. Yeah.
Yeah. And so that's just the algorithm. Like I said, it's all about algorithm. So that's what they're going to do. They're going to say, okay, we need a urinalysis. We're going to look at it to see what's causing the stress to the kidneys. In other words, we know that the numbers look like that we've got some sick kidneys, and that goes along with the drinking the water and stuff like that. But we got to find out what it is that's causing stress to the kidneys. And that's the first thing that we look at is the urinalysis. Okay.
And it's a free catch. Oh, I mean, I know you say the needle thing is better, but
yeah, it always is because it gives us an accurate reading. Sometimes you get lucky. Have you ever had to give urine yourself? Anybody that hasn't
Sure.
had to take the cup into the bathroom? Okay, what do they tell you? They tell you to get it midstream. Okay. And that the reason they do that is because, okay, sit here, think about your dog. Okay, you take your dog out and you're supposed to collect the urine. All right, well, the dog's been sleeping at night. And so what happens, it's got this bladder full of urine. And so the dog is, when it urinates, then that urine's going to come out of the bladder. It's going to come down the urethra and it's going to flush the urethra out. literally clean the urethra out, and the vaginal vault, if it's a female, is going to clean all that out. So it's going to wash out any cells and bacterial contaminant and stuff is going to come in, will be caught in that urine sample. You see, so when you look at it under the microscope and you see bacteria and you see cells, then you say, where did it come from? Did it come from the bladder, or did it come from contaminant? And so you don't know when you do a urine sample. So that's why they say midstream, so that when they urinate, they gives them a chance to flush that out. And then midstream, you catch it right there so that it's a cleaner sample. You see what I mean? And so what they're trying to do is that same thing we're talking with John a while back, or no, I think it was Jolene. If they get bacteria and stuff like this, and they go, oh, looks like we got an infection there. If that wasn't a cystocentesis, there's absolutely no way that you can guarantee that infection's coming from the bladder. It just can't happen. But the reason that they do that is twofold. One is that it guarantees they get a urine sample because you bring it in. Because if you took the dog in and she had an empty bladder, they're not going to be able to get any urine from her at all. So it guarantees they get a urine sample, and they're just hoping that there's nothing on there that's going to sit there and say, is this legitimate or is this contaminant? But my concern, if I was your veterinarian, that my concern when I get that urine sample out, and again, try to catch it midstream, is that I would really be looking, the two things I'd be looking at first is the urine specific gravity and then protein levels. But they're that'll all come out on the urinalysis, okay? Especially the protein levels. Those are really significant in dogs, not so much in cats, but in dogs, really important. Like,
Well, is that the UPC ratio?
no, was the UPC ratio done?
Well, they did it in September, and I don't know if I posted that again for you, but it was off, and her blood levels were normal. So now we have the not good blood levels.
So you had a urinalysis done before the UPC was elevated?
Yeah.
They should have jumped all over that. UPC ratio elevation means that the dog's got glomerulonephritis, and that's an inflammatory process of the kidney.
Wait, let me check. I'm looking back to September, but so should I now? Of course, now I'm really worried. So that means that Chloe's kidneys are like 75%.
If the creatinine is elevated, then yes, we've got at least 75% of the kidneys that are sick. But again, the important thing is the clinical presentation. How is she doing? How's she doing? Like I said, it would, and I see this all the time, Sabrina. You know, they get a high urine protein, and sometimes they don't do anything about it, even though it says, the next line says recommend to do a microalbumin protein or UPC ratio, and they don't do it. But if they do it and it's elevated, you can't sit there and say, I'm not going to do anything about it, because it's telling you you've got some sick kidneys because it's losing protein in the urine, and you got to be really aggressive to find out, because if you don't, what's going to happen down the road? Those numbers are going to start getting higher. Right. And that's what I talked to the lady on the phone today, and that's what she did. Her dog went in there and got blood work, and the numbers are up, this dog's 16 years old, and they gave it some KD diet and said, come back in 3 months and we'll recheck the numbers. Did nothing more. And so we can't let people get away with this not following the rules. And the rules are simple. They're standards of protocol, algorithms. That's what they're for. And we're all taught them. There's not a veterinarian out there that doesn't know. But
well, they should follow the rules when they want to charge you for the
and we've talked about
things in the world.
We've talked about this before, and it's really important that you understand this. When let's say that I've got a dog that's in the hospital and it's sick, and it's got all the signs of pancreatitis. Okay, and so I'm going to do blood work to see if I can get evidence that this dog truly has pancreatitis. Okay, so I take some blood out and we run a profile on it. It's a chem panel and a CBC. Okay, so the minute I get those lab results, what am I going to do? Because this is the way our mind works. the first thing that I'm going to do is I'm going to be looking for evidence of pancreatitis. You see what I mean? I did this blood work to see if this is pancreatitis. So I'm going to target in there and I'm going to look for evidence of pancreatitis. And so what does that mean? It means that imagine my consciousness, my focus is this big beam of light, and then pretty soon I'm focused on pancreatitis, and I target it, go down like this, like zooming down like this, and I'm looking just for pancreatitis. And I see this all the time. So they come in there and they're going, look, there it is, there it is, there it is. And they don't even look at the rest of the lab work. You see what I mean? Don't even look. They're just, that's what I needed to know right then. Out the door they go. I had a guy I worked with 6 months ago, and he had a dog with kidney problems. And they did just the opposite. They were focusing on the kidney numbers, and they zoomed in on the kidney numbers, and they didn't look at the pancreas numbers. And they were, I mean, we're talking about below 200, and they were above 5,000. I mean, it was excruciatingly high, and they just totally overlooked it. And so this dog had kidney disease secondary to the pancreatitis. They didn't even pick that up, even though I don't know if I'd ever seen these numbers as high as they were. And they just totally missed it. They didn't look at it. And so that's what happens a lot of times. And if they were looking for something else and they got that UPC ratio of whatever it was, chances are they could have probably just ignored it or just not even noticed it. They sure charge you for it.
I have her protein, is that PRO, was
Yeah.
100 in the urine
Yeah.
on September 12th.
And so if you look below that, there'll be a little line that says that by the lab, recommend the UPC ratio or something like that. In other words, you need to investigate this.
Yeah, and we did, and because you drew our attention to that, I marched back there and asked for it, and they were like, they made me pay for a second one, and they should have done. I said, your own lab says do UPC ratio, and so then
Exactly.
and that's because of you that they took off the charge. But yeah, I now I can't find the result for the UPC ratio, but
Yeah, and they should have, if it came back elevated, they should have gotten real aggressive with that in hopes of keeping those numbers from going up. Because if you don't do anything about it, they're going to go up. They just have, if you got sick kidneys, you got to find out what's caused, and you got to focus on what the cause is. Otherwise, and that's what gets me about vets that say, hey, put them on KD down and come back in 3 months. What are they expecting? Like,
I found it, Dr. T. They said the UPC ratio is 0.57. They said to come back in 6 months.
that's what I'm saying. I'm saying that the high normal, if anything, 0.5 and above is above normal. So that UPC at 0.57 was abnormal. And so what they did was they wrote it off. They just sit there and said, hey, come back in 6 months, we'll check it again. Now they've done blood work again, and now pretty soon, boom, now you got elevated kidney numbers.
But we did Glennia and Romania with you because you said to put her on after that.
And Romania, again, helps support the kidneys. But the point is, it's got to be, we've got to start working on focusing, because Glennia and Romania, remember, we've had these problems with the liver before too. And it tries, it supports kidney and liver, yin both. But now we're going to have to turn some real focus on the kidneys. Okay.
Is there hope? I mean, does this just mean like her kidneys are done and we just...
No, absolutely not. Absolutely not.
They can't recover after being 75% shut down, right?
Sure.
They can?
Sure. Heck yeah. We do that all the time. Again, depending on the cause. Gotta find out what the cause is. Okay. So let me, again, I'm gonna look over this stuff and I'll shoot you an email, okay? All right?
Thank you.
All right, guys, we're gonna have to do a little sending her a lot of energy, because you know what she's gonna do? She's gonna toss and turn all night.
I know. Never do well. It's
Well,
true.
I think part of it is needing to hear, because we focus, we're honing in on the values and what this means, and deeper in the weeds. And then sometimes we need to hear but here's what we can, here's some hope out here.
Yeah.
Because Sabrina, I see you, sinking this hole, because I would be too. I'm like, oh my God, but when we know, well, wait a minute, then there's some Yeah, there's some hope. We can reverse some, whatever. We,
Yeah.
yeah, we need to hear that too, because otherwise, yeah, we all will just sink into that vortex.
yeah.
Like,
Yeah, and the sad thing about it is I get these people that contact me and they've got a creatinine of 2.0 or something like that. It's mildly elevated and they go, well, the good thing it's only in a grade 1. It's only a grade 1. And it's like, well, I hate to be the bearer of bad news that grade 1 means you got some really sick kidneys. Oh, because it's a grade 1 instead of a grade 4. I'm feeling a whole lot better about it. And it's like, well, sometimes we have to sit down and discuss exactly what's going on. But what bothers me is exactly what you said. We're not going to do anything about it. We come back in 6 months and check it again. And if it starts getting really, really high, then maybe we'll turn our attention to them. And the reason being is because they don't have anything if they had a pill that said, hey, this is going to drive this UPC back down to normal, then they would have prescribed it. But they would have had to go in there and say, okay, now we got to go back to the table and find out why this dog's got glomerulonephritis, because they have a diagnosis. As soon as that UPC came in elevated, they've got a diagnosis of glomerulonephritis. Yeah. So we'll get to work on it and don't worry about it. Okay.
Thank you. Look, Chloe
Uh,
came to say thank you.
oh,
Yeah.
she,
April,
Absolutely, right
since
there.
you're new here, I'll give you just some general information. If you run into a scenario that you need some help with clinical problems, then get a hold of Jolene or Hannah. And if you need somebody that you need some help with compassion and caring, that's Jonna's department.
And Melissa.
And Melissa.
And Jolene. And Betty. And Leslie.
If you
Everybody.
need, if you need
And
somebody to
Sabrina
worry
too,
for you,
though.
that's Sabrina. Sabrina does all the
I'm the
worry.
worry, yeah. If you need to worry, just come to me. I will.
Sabrina, you are
do
so
it,
supportive
Lori.
too. You didn't even know me when Kirby was sick.
So
and
they
you-
all have assignments. So Jonna's is and Melissa's in the compassion deal. Sabrina's
Natalie,
in
too.
the-
Natalie too.
Natalie, is Natalie here?
She was.
I think she
was here.
Yeah, Natalie's good too. But Sabrina's our group warrior.
Queen warrior.
The queen
Not
warrior.
warrior, but warrior.
Warrior. She's
Warrior,
the
warrior.
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 Everybody,
warrior.
everybody
Yeah.
here is filled
I
with
worry
love
Worry
and
so much
compassion.
that I can feel
Yeah,
her vibe.
everybody.
I could have used all of you, all of you.
She worries so much that I can feel her vibrations from all the way from where she lives to Spokane, Washington.
Oh, I can connect with that.
Special talent.
Yeah,
Oh, many, many sleepless nights. Like
yeah,
you can literally feel it. Not with you. I'm saying like with my own anxiety and worry. So yeah.
yeah.
Me too, April.
And my only anxiety is worrying about you guys.
Aw.
Oh.
You guys. I tell Lisa all the time, oh gosh, Jonna's cat, I told her today, Jonna's cat said, anyway, so she knows how much I worry about you guys. But I don't worry about your pets. I don't worry about them. I focus on them, but I worry about
Well,
you guys.
even after the little bit of anyway, just the little bit that I know about your work, I'm already contemplating just packing up my animals and moving to Spokane. So
Man.
I don't know that I can handle another sick animal without you. So yeah.
Believe me.
Yeah.
So
we
April, you kind of have all of us too, because
Yeah.
Oh,
we-
really? This is a great group, but there are, and I'm just saying that because I like to poke fun at Jonna and Sabrina, but all you guys are just outstanding. And
So I mean, I'm assuming that there are others, in the group. Obviously, we're all pet owners, pet lovers, but are there other veterinarians in the group or
No.
like?
we
Okay.
don't allow other ones. That would be
No.
conflicts of opinion, and I
they're
have
not
the ring.
allowed.
Yeah.
I
Okay.
have the ring that you have to kiss, and so no, veterinarians are not allowed. No, I'm teasing. No, they're
We
not.
have-
No.
We have an animal communicator. She's not here. She's
Yeah,
really-
that's right. We do. We
Make-
do.
Yeah.
Dog
Do
trainer.
Okay, so
Dog
question,
Yes.
do animal communicators I'm really new to this. Do they work with deceased animals as well, or only?
Yeah. Yeah, absolutely. They work with and not just dogs and cats, but fish, you know, any animal. And I will tell you that Meg Vick, because I've taken some of her classes because I'm working for that. Leslie did too. I think.
Yeah, I did.
I'm
I
outing
just,
you a little bit.
no, I really, and I want to take some more. I just haven't, it just hasn't worked out since I've ended up at home with the surgery. But once I
No,
get back to normal life, I'm going to take more of her
Meg's
classes.
usually here. I'm surprised she's not here.
Yeah,
Yeah.
I think she has a lot going on, but she's so Meg Vick, you can look her up, Modern Day Doolittle. She's not only just a communicator, but I mean, she should just be like a counselor, like therapist by heart, because she's in tune with everything. It's not just animals, but she's really in tune with everybody. She keeps her group small when she does the classes, because she really wants to pay attention to everybody and hone their abilities. But but anyway, yeah, she'll decease, and I've done some sessions with her, and I would validate she's the real deal.
Okay, what's her last name? Meg?
Meg Vick, Vick, or Vickle is the whole name. But if you just Google Modern Day Doolittle,
Yeah.
that's
Okay.
where
On
you'll find
Facebook. Yeah.
on Facebook. Yeah.
Okay.
And then we have Megan, also Satya, who is our Kundalini expert.
Yes.
So, and then looks like we've got a latecomer here. What is your name? I don't remember your name.
Who's that stranger?
Hi.
Hannah. Hannah is our nutrition expert. And so if you ever need help with nutrition, she's the one to go for.
Food obsessed.
She's really
Oh,
That doesn't mean that's all she's
Dog
good.
show champion, right?
She is like she's a master of everything, but nutrition is her big thing.
okay.
Yeah.
You're too kind.
Yeah. So one of these days I'm going to fade off and you guys won't need me at all anymore. You'll have
We
this.
always need you.
Ever.
Always need you. Always.
You
Self-sustaining.
better not fade off.
Yeah.
Like last time,
Exactly.
last time we had a group and I had to leave. I somebody's birthday party and we were doing a FaceTime and I wanted to do we'll often do a guided healing meditation for sick pets and stuff like that. And I think Megan, didn't you lead that for us last time?
Yes, she
Yeah.
does. Yeah.
I did.
How was that?
good.
guy?
So good.
Was it
Megan
good?
was awesome.
So it's safe to turn
That's
that over
great.
to her from now on occasion?
Yeah.
Yeah.
But that means
Yeah.
less pressure on Sabrina.
Yeah.
Sabrina does an excellent guided healing meditation, but she's so embarrassed she won't do it.
Too rusty.
You
It
do a
really
really good
is,
job,
yeah.
Sabrina.
Everybody always
As
say,
good as
"Can
Meg."
Sabrina do it? Can Sabrina? She does such a good job. And then, and then it's like, we're tired of hearing you, so we want to hear Sabrina. Yeah.
Nobody.
So I do have a question, kind of the best way to go about this. And I think maybe scheduling an individual consultation with you, Dr. Thomas, would be the best way, because otherwise I mean, I could monopolize this entire Zoom meeting with all the questions that I have.
That's why we don't let the first timers
We
ask
all-
any questions.
What?
That's why we don't let first timers ask any questions.
Oh, no, I'm just here to listen.
He's
and-
kidding.
That's
Don't
what I
pay any
thought.
attention to him, ever.
So, well,
Ever.
I
Wait a
currently,
minute, everybody's saying the same thing. Come on, give me a break.
I currently don't have any sick pets. 2 weeks ago I did, but I currently don't. Luckily, my cat is doing well. She's been relatively healthy her whole life, but she is 12 years old. And I have a lot of questions about senior care, prevention, everything from, I don't agree with the recommendations as far as getting her vaccinated yearly, how often to get her teeth checked and cleaned. Every time she goes to the vet, she has to get sedated because she doesn't do well. I'm just a lot of really detailed question about kind of ongoing care and just how to manage a cat that is getting older but doing well, to prevent some of this stuff. So
And that's ideally what we'd like to do is to be more proactive when it comes to healthcare.
Yeah,
trying to head things off before they, because it's a whole lot
Yeah.
easier to prevent things than to treat them once they happen.
yeah,
Yeah. And unfortunately, conventional medicine is a very reactive perspective. It's an assumption that everything's well until it gets sick. And there are
Mhm.
very, very few well individuals out there.
yeah, yeah. Well, in her like her upcoming annual visit with her vet is coming due, and I mean, even things like I said, I've been really lucky up until the last 6 months to have some healthy pets. So, you know, when we talk about blood work, I really don't even look at. I haven't before looked at the blood work with my vet. He just says it's fine. I'm like, great, and I get on with my day. So I don't know how to read stuff or what to ask for, how to even start having these conversations with my vet. So
That's the
that's
whole
why
purpose of this group, is to empower yourself.
yeah,
Because
yeah,
I like to say, I do consultations every day, and
okay,
probably 60% of them, veterinarians have either made mistakes or been negligent. Or this one lady I talked to today, I swear that she could go out in front of the board and file a complaint on how her pet, and it's just sometimes, and I don't know why. I don't know if it's too busy or what, or insignificant, you know, but we've got to empower ourselves. We can't allow ourselves. And that's one of the reasons we're here, because if you ever have something that comes up, and all you have to do is put a post on and tag me, and we'll get all over it.
okay, okay. Well, like I said, I think I have enough specific questions, just wondering about your opinion, like about some of the very standard recommendations as far as vaccines and whatever, but I
Well,
think,
let me just say that other than the puppy that we just got, and we've got one that's 14-year-old dog, an 8-year-old dog, and a 15-year-old cat. And none of them have had vaccinations since they were puppies or kittens.
okay.
So I
I love
don't,
that.
no, we don't do that.
Yeah, my cat hasn't had, she did finally have to get a rabies vaccination because her vet refused services until she had her rabies. Can they, can they do that? Is that?
That's, I had a conversation with again with a lady today, and there's two, think about it two ways, okay? What's in the best interest of your pet, and what's in the best interest of this business? You see what I mean? Okay. So this vet saying, you need to bring your cat in to get a rabies vaccine, otherwise I'm not going to work on it. That vet knows as well as you do and I do that there's no way on God's green earth that your cat's got rabies.
Yeah.
Okay. So, but they've got what they call hospital policy. And their hospital policy says, hey, we're not going to work on anything that hasn't been vaccinated for whatever their hospital policy is. And so it's extremely hard to find veterinarians that don't have this hospital policy that says, hey, you've got to at least have a rabies vaccine. And they can justify that by saying, okay, let's say that you bring your cat in, it's not been vaccinated for rabies, and we know that your cat doesn't have rabies. Why? Because your cat probably stays inside all the time. The chances are of it getting rabies are none. You know, I've got just as much chance of getting rabies as your cat. Okay. So, but let's say that you took your cat in for whatever, and the technician's holding the cat, and the doctor's palpating the abdomen, and your cat bites the technician, just bites it, breaks the skin. By law, this bite has to be reported to animal control. Okay. And the minute animal control gets involved, the first thing they're going to say, is this a vaccinated cat or unvaccinated? Now suddenly you're in the system. And then if it's not been vaccinated, then you've got to follow these rules. If it has been vaccinated, you've got to follow these rules. So that's what their defense is. If your cat bites someone, then we got to go through all this. I've got a lady here that got bit, and we don't know if your cat's got rabies or not. You see what I mean? And so that's how they can stand back and defend this, even though they know that your cat doesn't have rabies. So what they're saying is, we want to make sure, and you, if you've been here long enough, you hear me talk about rabies is probably the worst vaccine that we can give. Okay. because most of the rabies vaccine has a preservative in it called thimerosal. Thimerosal has mercury in it, and mercury is a toxin. Okay, so most of these pets that are getting rabies vaccines, we're blasting them with mercury. And so that, and no animal should be getting this, but especially a senior pet. I mean, come on.
Yeah.
And it's
Yeah.
the same thing. Let's say you had an emergency and you had to board your cat. And the border says, hey, our policy here is that you can't bring your cat in without vaccines. You see what I mean? So even though it's not in the best interest of your cat, our policy is, and if you want to play by our rules, if you want to play with us, you got to play by our rules.
Yeah.
That's exactly the
I couldn't get a groomer with my dog that would take my dog, and my dog didn't have any teeth, and they
Yeah.
still.
It's her policy. Now, I will say
Yeah.
that in the last 10 or 15 years, there's been some relaxation to that on some of the groomers and stuff like that are starting to relax because some of these people are starting to come into the realization that, hey, it's not in the best interest of these pets to get vaccines. So they're not having their pets vaccinated all the time. So they're loosening the rules up a little bit, but that's
Yeah.
really slow to come. And you're not going to see that in a vet clinic. They're just,
Yeah.
I hate to say it, but veterinarians these days are so focused on bottom line. It's really scary. It's really scary.
Yeah.
But
So what is your opinion, just really quickly? Because the other thing that I'm getting a lot of reminders and stuff about is annual teeth cleaning for my cat. That's a maker. I don't know, but
the thought of annual teeth cleaning, to me, that has profit, that has money written all over it.
yeah, me too.
Because we don't do annual teeth cleanings. We do teeth cleanings as needed. You see what I mean? So what they're
Mhm.
saying is, we're going to clean your cat's teeth no matter what they look like. And that's crazy. Why? Because you got to put them down under general anesthesia. If it's a senior, you got all kinds of risk involved.
Yeah,
And so
yeah.
100%
Yeah.
about making money. Nobody that's in the interest of their pet sends out annual teeth cleanings. Now, some of the corporate veterinary hospitals, they do that. That's just their way of making money.
Mhm.
The dental business, and people will tell you here, dental business is a big money making thing in veterinary medicine.
Mhm.
Why? Because the technician's doing the cleaning and the doctor's off seeing other patients. You see, so they're making that money having the technician. So it's a real high net income is dental work. Okay.
Yeah.
But
Yeah.
don't let anybody get you on a routine. And some of these corporate like VCA, Banfield and stuff, they'll sit there and say, hey, we're going to sell you this insurance policy that says, hey, if you come in and get your vaccines annually and would do a teeth cleaning annually, then we're going to give you 30% off right up front. It's just all about making money. It has nothing to do with taking care of your pet. Nothing.
Yeah.
And the thing that scares me the most of what you've told me is that you said every time your pet has to go in, they have to sedate it. You have to sedate it.
She's terrible with the vet. She's been denied services. She's been fired from more than one vet because she is a hisser and a spitter and a biter, and she just doesn't do well at the vet's office. So,
and most cats take on the personality of their owner. Like Jonna.
I know. I read your book about like heal the part about heal the owner, heal the pet, and
No, you'll learn that about half the stuff that I say is just to poke you.
but it's no. This is. I know that you're joking around, but there is a small part of me that is worried. I'm like, am I doing this to her?
No. The point that I'm making is that it's back to that cost benefit. If I've got a cat that I'm going to have to sedate to take in for a routine something, then I'm having a hard time doing that.
And she really hasn't been to the vet very often. The only time that because of that very issue, she's had terrible reactions to vaccines in the past. Like I said, she's been fired by vets. So she's really only seen a vet for acute emergency care up until now. And
that's what I would do. My gut tells me, hey, if it ain't broke, don't fix it.
Yeah,
I would be talking to you differently if you didn't have to sedate your cat. But every time you sedate seeing your cat, then you run the risk of bringing things to the surface.
yeah, okay,
Yeah.
okay.
Anybody object to that?
No, I was gonna, and Dr.
I was
Thomas, you
gonna
can
say
see what you say,
in-home
what you can, oh. I'll just say this real fast. Like I was just, so I have a 14 and a 15-year-old dog, a Pom and a Dachshund, and I actually kind of go to different vets, but there's a vet that's kind of more out in the country, and they seem to not be so rigid by the whatever the veterinary like professional organization rules are. And they're like, "Are you continuing to give heartworm?" Because I do give heartworm, and I'm like, "Yeah." They're not going to keep drawing the blood, or they're not going to keep giving the rabies and distemper. Like they're just like, you're. I'm like, "Yeah, they're indoors. That's so they're sensitive to that." And what's the other thing? The dental stuff, and I don't know if Dr. Thomas if this is okay, but they both have heart. These are my two older girls that have heart murmurs, and and they have really bad tooth, like bad teeth problems, and they're not pushing any kind of teeth cleanings, and they're like, we can just do a round of antibiotics every so often, because obviously my understanding is that like infection, if it's in the gums, can run through the bloodstream and impact the heart. There's a heart murmur, so we'll run them on some antibiotics, but they don't. This particular vet is not pushed like the other vets closer to the city where I am want to push this stuff, but they're like, we'll just run some antibiotics every so often. I mean, and Dr. Thomas, is that okay? And April, I'm wondering if that is even and they're definitely not pushing like, oh, once a year, or it's just because at this point with those older girls, they're not going to put them under. They're too old.
Okay, remember, we have, and this is really important, and I know you guys have heard this many times before, is that it's very rare that we rely on generalities, okay? It's very rare, okay? Because every one of these is an individual, okay? And you have, no matter what you're dealing with, you've got to deal with your pet as an individual, because you might have a cat that's got this disease, and John might have a cat that's got the same disease, but how they're going to deal with it, how they're going to respond to treatment, the reason they got it are going to be completely different. Okay. And so that's one of the problems we have and these guys will tell you, we talk about it all the time. Conventional medicine is all about treating conceptual diseases, and that's generalities. And that's why we have such limitations. And Melissa, for your scenario, let's say that I was your veterinarian and you came in and you brought one of your dogs, and I'm doing an examination. And I go, wow, your dog's got some really bad teeth and some severe gingivitis, and it's really bad. But I've assessed your dog, and I say, oh, it's got a grade 2 heart murmur. And then I'm questioning you, and I see the blood work is normal, and you're telling me your dog's running around and still goes on walks and stuff like this. And so I'm sitting here on an individual basis saying, okay, for this individual dog that has a grade 2 heart murmur, but the heart's functioning fine, still has good cardiac reserve, et cetera, but yet it's got a bunch of rotten teeth and a lot of infection in the mouth, then I'm going to clean that dog's teeth. Okay. Now,
Even under anesthesia.
Absolutely. Absolutely. Okay.
At 15. Yeah.
Again, depending on the situation.
Okay, I see. There's the nuances. Okay.
Yeah. No generalities. Okay. Let's just say the veterinarian says, hey, it's a 15-year-old dog, got a little mild heart murmur, really bad teeth. Let's just do the antibiotics because we know we're going to knock the bacterial population down, but it's not going to do anything about cleaning the teeth, et cetera, et cetera. So let's say they do that, and then a month later, all of a sudden, your dog's right under its eye. You get this big swelling, and the dog is crying, and it's in a lot of pain, and it's really in trouble. And then you run down to the vet, and the vet goes, "Oh, we've got a root abscess in an upper fourth premolar, which we could have prevented by doing that teeth cleaning a month ago." You see, and now we're going to have to go in there and do that anyway and extract that tooth, and now we got an infected mouth. You see what I mean? That's where it comes in that says hindsight's 2020. Boy, we wish we'd have done that cleaning back then. And so that's why we have to assess it on a case-by-case individual situation that says, hey, you know, what's the chance of this getting worse and causing a clinical problem? And we don't know, but what I'm saying is that sometimes you have to make that choice. If you've got you know, if the dog's having trouble eating, there was an old thing that when I would have a senior cat that would come in that presented because it's vomiting its food, okay? The first thing I'd look at was its teeth, okay? Because if its teeth were bothering, then what they would do is they would swallow the food whole. They wouldn't chew it because it hurt. And they swallow the food whole and then they vomit the food back up because it hasn't been chewed up, okay? And so we had to do something about the teeth to get them to stop vomiting. So that can be a factor too. So we're having to look at all of that and make an assessment that says, hey, we got a 15-year-old patient here. Blood work looks good. Heart sounds good. Appears to be functioning normally because it's chasing the squirrel in the backyard. So the chances are we can do that sedation and take care of this before it becomes a real problem. See what I mean? So sometimes you just have to go with laying it all out there. What does my gut tell me? You know, we're not going to react from fear. We're going to react from what's in the best interest of the pet.
Well, and intuitively, I've kind of known that or done that kind of my whole life. Is the few times that, I mean, she's just had such terrible experiences at the vet's office. I'm like, this isn't, unless she's really sick, this isn't worth it.
Exactly.
I think now having dealt with a senior dog, I think I've got a little PTSD about not taking, I only had her for 2 years, my dog that passed away, and she was severely neglected, didn't get medical care when she needed to. It was very obvious. So I think I'm a little bit scared. I'm scared that like I'm doing that to my cat and not getting her the help that she needs. So I think I'm kind of questioning my judgment in that regards.
Yeah, again, that's what happens with the busy mind, the you know, the fearful mind. And just like you said, your intuitive guidance is your guiding mechanism, not this busy intellectual mind that's trying to figure out all these variables that you can't.
Yeah.
What you've told me, my gut tells me, do the basics, feed a healthy food, blah, 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 do everything that you can preventative wise. And if it's not broke, if she's feeling good and she's doing good, don't take her to the vet. She's one, you're going to have to sedate her. Two, it's going to be mega stressful a bit for her. So don't do it.
Are there any, I mean, if I do find a vet that can work with her, ages ago, there was one, he has since retired, that would work with her not being vaccinated and given her temperament. He was pretty good with her, but my biggest thing is monitoring even like yearly blood work. Is that even worth it? Or do you wait until your pet starts showing symptoms?
That's a good question. I remember when we first started doing senior exams, okay? Senior exams, and that was probably 30 years ago. Somebody through Vet Economics, which is the magazine that teaches veterinarians how to make money. They came up with this idea to do a senior profile. So what you do is every year you send out, your computer kicks out a reminder that says, send it out to this pet, because your pet's over 7 years old. It's now considered a senior, so it needs to come in for a senior exam. Okay. And that's a great way to make money. And that's what it was all about. It literally came from the Vet Economics magazine. This is how you can boost your income. The thing about it is, if you're sitting there making a case in front of a panel group, and you sit there and say, okay, look, I get the pet in, you know, this pet comes in once every 3 years to get a rabies shot. And so I don't see it for every 3 years. So now I get to see it once a year. So now I come in, I'm going to give it an examination. Yeah, it does need a teeth cleaning. It legitimately does need a dental. So yeah, we got to get that taken. So we're looking for things that we can address right now before they become a clinical problem. Okay. So we do blood work. And so most of the time it comes back normal. Sometimes it doesn't. Sometimes you pick up things again before it becomes a clinical problem. The perfect example is a dog with hemangiosarcoma. Anybody know anybody ever had to deal with that? Splenic cancer, okay? Splenic cancer is a unique scenario because you can have a big, giant cancer growing in the dog's spleen and they're clinically normal, okay? So almost all dogs that are diagnosed with splenic hemangiosarcoma are caught on routine examinations or they're brought in for something else. So the veterinarian is listening to the heart, palpating the abdomen. They go, oh, your dog's got a big mass in its abdomen, even though it's acting perfectly normal. So they take an x-ray and go, oh, your dog's got a big enlarged spleen. And then you find out that it's got cancer in the spleen. And the only reason that you picked that up was because you brought it in for your senior exam. So there's times that, yes, you bet. And I used to say, when we were using Rimadyl, anybody familiar with Rimadyl? The anti-inflammatory? Okay, when Rimadyl first came out, they said, okay, it's bad on the liver. So you got to have your dog come in once a year to check the liver enzymes. I thought that was great because of the fact that I can't tell you how many dogs I picked up that had hemangiosarcoma that came in to get their blood checked for the liver enzymes. And I just happened to do it a good exam and it's like, whoa, your dog's got a splenic cancer. And I would have never known until that cancer ruptured and the dog could have bled to death. So yes, there's strong evidence that, and that's what we want. I mean, I don't know how much you spend nowadays for a senior exam, but the point is if you drop down $200 or $300 and everything comes back normal and you go, wow, that's good. And that's what you want. But how thorough is that? In other words, you could have a dog that has a gastric carcinoma or inflammatory bowel disease or some other major GI problem, and the blood work can come back absolutely normal. So and I tell everybody here, and they'll tell you over and over again that sometimes it's a superficial look, and it means that if it comes back normal, that's good, but it doesn't mean that it's 100% saying that your dog is in perfect health. But at least there's not any red flags that are saying you need to do something about it right now. So I encourage routine exams, but in your cat's case that you have to sedate it, I would have a hard time dealing with that. Yeah.
Okay. No, that's helpful. Because that's, like I said, just coming off of one sick animal, I'm very hyper aware and kind of questioning my own judgment and all of that right now. Like, do I really know what I'm doing or what's best for her? So
well,
that's very helpful to hear.
Well,
April, I get that. Oh, didn't say something like
any
that.
suggestions? Let's just say that April had to let's say your cat was acting weird and she says, okay, even though I don't want to, I've got to go to the vet and I'm going to have to sedate this cat. What other options does she have besides sedating the cat? What about natural remedies, guys? Come on.
Yeah, like lavender, do some Reiki on her.
What about rescue remedies?
Rescue remedy.
Rescue remedy.
Yeah, is that the flower essence?
Yeah.
The Bach remedy?
Yeah.
So
Yes.
there's
I
natural-
just purchased that 2 days ago. I read about that in your book, and
Yeah. So there's
we are
remember-
loaded up on essential oils and flower remedies.
Remember, veterinarians aren't trained to learn about Bach remedies. They're not trained to learn about essential oils. They're not trained to learn about herbs. They're not trained to learn about feeding fresh food. We're not trained that, but that doesn't mean it doesn't exist.
Yeah.
Get out of there. And so the point is, I had a lady that I talked to the other day, and she was giving her dog trazodone before she goes to the vet because it freaks it out. And yet trazodone is really, really tough on them. And it's like, you don't have to do that. You can give some natural stuff that'll do the same thing. And so that's what we're here for. In other words, we don't want your cat to be sedated. If it has to go to the vet, use the rescue remedy before you go. And then they won't have to sedate it. Okay.
But what if you have like my dog Kenzie, who's a rescue, who is completely traumatized, but she's doing well in our home. But yeah, it sounds similar like that, what April's saying, like the severity of her anxiety, it's just out of the ballpark, and none of those natural things work. I mean, they don't. I mean, it's almost like she's like an elephant, and you can just keep injecting, and nothing natural works for her. Like,
Mm,
I don't know
mm.
what, because it ends because of trauma and PTSD in my dog, and which she's fine at home, but when she has to go to the vet. So I don't know, like, you know what I mean? It's almost, she's beyond the
She
threshold.
like fights it, right?
Well,
She's just,
Yeah,
like,
yeah,
yeah,
yeah.
she's like, I'm not
well,
gonna,
first of all,
always like that.
I've never seen a dog that we couldn't find something that worked. And so there's a factor going on there that, and it might take more than one thing. You might have to give some rescue remedy and some lavender on top of the head, what have you. But usually a combination of things are going to calm it down enough to where you can get into the vet. The first thing that pops in my mind is, how do you do with this situation? In other words, when she's freaking out, are you freaking out too?
Yeah.
Okay.
No, I'm
Oh, are you
pretty,
asking me or?
No, I'm asking Melissa. She's
Oh.
saying that none of
no,
this natural.
I'm actually pretty good at grounding and staying centered. I've had so many animals my whole life, and then
I'm
just,
talking about when you get ready to take her to the vet, you know, she's
I'm
gonna.
very calm. I
Okay,
am
good,
very, very
good,
calm. I am very calm. I have everything ready. She doesn't even see me having everything ready. And then I just, like I pick her up like I would. And then I'm like, okay, let's go for a ride. And I'm very, very calm. It's just, it's more like the severe shivering, the, she just came to me, like none of my other dogs, they'll have like a little, everybody might have a little trepidation about going to the vet, but we can deal with it. She's just,
Again,
I've only had a year and a half, and
I'd be looking rescue remedy. I'd be using lavender. I'd be doing
I haven't tried lavender.
GV20. I'd be doing pericardium 6, heart 7. Uh,
That's what I need to learn.
Ashwagandha is good at calming and relaxing.
Ashwagandha.
So you just have to find the right product or the right combination that's going to.
Yeah, and
test it before, test it
that's what
before you go.
you're right. That's I think that's the key, is the right combination, and
It's an experiment.
So Hannah,
Experiment.
yeah, Jill.
Well, I want to add.
Hannah, let me ask real quick.
that-
Let me ask Hannah, what would you recommend for her? Her nervous
Same
dog.
thing, the rescue remedy. And I would also do the behavioral aspect, and that is drive to the vet's office and just sit outside on a day that she doesn't have to go, because
Oh, yeah.
that's, yeah, if
Counter
there's,
conditioning. Yeah, counter conditioning.
Yeah.
yeah,
I hear you on that. Like,
Good idea.
just maybe take her more car rides.
Yeah, I like that. Would you even take her like as far as into the lobby area, or?
I would.
Yeah,
I would
just,
do it in stages, because what I learned from training and agility is we want to get from showing up on the course and then doing the whole course, when first step is just being there, and then the next step is taking one step. And
in the
for a dog
carrier,
that's,
in the
yeah,
car,
Baby
yeah.
Yeah, yeah.
for
yeah.
for a
how many
dog that's
people-
that
And
shut
only when
down.
she
And
succeeds.
with cats, how many times do you go to get the carrier and the cat? You can't find it anywhere, I mean, the minute they sense that carrier's coming out, they're gone. And that's all conditioning, and that's what you do. You just
Yeah.
have to counter condition, get them used to the carrier coming in. And I think that's a great idea. Taking it and sitting out in the parking lot for a while and then leaving and going back home.
And if you have two animals and one is okay with the vet, what I always do is I bring Keegan, because he's the emotional support dog for everybody. And so he
Yes.
comes to the vet, he like sits and watches Chloe get like an ultrasound, and he's just chilling. I just give him bully sticks and treats the whole time. So when it's his turn, he's just like, this place is awesome.
Yeah. He
That's
calms
perfect,
you-
Sabrina,
he
because my
calms your
Kobe,
energy down too.
Yeah,
my
yeah,
Kobe
well,
can do that.
I like this
Yeah.
idea. I'm gonna start by just getting her carrier out.
There you
letting
go.
her sit
Yeah.
more often, so that she's a little bit more used to
Yeah.
that. 'Cause
Sometimes
if it's
people will
sitting
crawl
out
in the
long enough,
carrier
she'll
with the
eventually
cat.
start
Yeah.
getting in it, so. Yeah, I forget
Add
about
the
the
favorite
behavioral
treat.
part of it, but
Yeah, good.
Dr. T, what's the oil blend again? It's like 5 drops to 20 drops of coconut.
10 drops of essential oil into 1 tablespoon of fractionated coconut oil.
I gotta remember that 10 drops into 1 tablespoon, right?
And that's for when you put it on them.
Yeah, we have to dilute
One
those to use them.
teaspoon or
in
one
it.
tablespoon? Did you say 1 teaspoon or 1 tablespoon?
10 drops into 1 teaspoon. No, I'm sorry, 1 tablespoon. 10
Tablespoon.
drops into 1 tablespoon.
Oh,
Okay.
okay.
And then
Well,
put
and I use the doTERRA, I don't have one in here, the roll-ons, or they call it doTERRA Touch. And I'm sure I read that it was
diluted.
already diluted
Blended, yeah.
like that. So yeah, I always
Yeah.
try to buy those and then I don't have
Awesome.
to
Yeah.
mess with them. Yeah.
What's it called? So, Leslie, say that again.
It's the doTERRA oils, like you
Okay,
can get
okay.
like the doTERRA Touch, like lavender touch, or
Okay.
whatever. I use
Awesome.
frankincense. I've actually been using frankincense on my incision on my ankle, and I had heard that it was really good for scarring, and it's clearing it up. Like,
Frankincense is really good. I like to
yeah,
put it on my cancer.
I love that.
I've been using the lavender hydrosol too. I have both the
Yeah, for
essential
cats,
oil
yeah.
and the hydrosol, and my cat will tolerate the hydrosol.
That's what
much
I
better.
recommend for cats is the hydrosols. Yeah.
Yeah,
Because it doesn't have the oil in it. And remember, cats don't have the liver enzymes to break that oil down. And so you have the potential for liver problems with that.
So
Even though
I
some
do
veterinarians,
have a question, like with the essential oils and the hydrosol, well, the essential touch therapy, or excuse me, the essential point therapy. If I get too handsy with my cat, she doesn't love it. She has very strong boundaries about that. Things need to be on her terms. Is it still effective? What I've done is I've just tried to kind of brush and pet over the points that were recommended for aggression. That seems to be what we're working on right now. But
What
is
I would
that
do-
enough without actually getting it like rubbed into her fur and her skin?
no, and you don't have to rub it in, but what I would do with her is I would use your lavender hydrosol,
Uh-huh.
put it on your palm of your hand and then pat her on top of the head. And
Yeah.
then wait about at least 5 to 10 minutes. And then that's going to activate a calming point on the top of her head. And it's going to relax her. And so that you can go back and do the other points.
Okay.
Yeah.
Okay.
Works really well. Yeah.
Yeah, because she does seem to calm pretty quickly when I do the lavender hydrosol. So that's a good approach. I've just tried to like sneak attack her until now. That's not working. So
And again, on days like that, you know, if you have the rescue remedy, just put some rescue remedy in her mouth and give that a little bit of time, you know.
yeah.
It worked again, when I was doing acupuncture on so many patients, they would come in, I'd start to work on it. And I'd say, oh, you forgot your rescue remedy today, didn't you? And they go, yeah, I came straight from the work and I was in a hurry. So I could tell which ones had the rescue remedy and which ones had not. And so that is major difference. So,
Yeah.
yeah.
Okay.
How do you put it in their mouth, Dr. T? Because I don't,
her cat, carefully.
well, any animal, how do you put it in the mouth?
You know, ideally they say into the tongue, but just to get it in the mouth. And even if you can't get it in the mouth and put it on the food or in the water, some people that have real fractious animals, they'll put it and keep it in their water bowl all the time. Yeah. Remember, it's a Bach flower remedy, and you're not gonna have to worry about toxins. So you can't OD them.
The stuff I have is a spray too. And I remember with Sparky, I just would sometimes just kind of spray it like kind of around his face a little bit and you know, or kind of at his chest. And I didn't even get it inside of, you know, like internally, but it seemed to have an effect on him, just breathing it in kind of thing. So
Okay. Well, anything else?
I have a question.
Sure.
My question is about Mia. There's a couple of symptoms that I've noticed about her. Like, you know, she's taking the blood palace for the nose thing. And it seemed to clear up, but now it seems to like still be scabbing a bit again.
Are you doing
I-
anything topically with it as well?
The Manuka.
Nuka? Okay. Good.
Yeah, that seems to be doing a good job too. And I just don't know if like the blood palace is actually helping or not.
How long has she been on it?
Hold on, since it's only been like 2 weeks.
Okay, yeah, it's too early.
Okay, so we'll wait a little more to
Yeah, I'd be
see
looking 4 to 6 weeks and see what you look like. What
how
the
long.
4 to 6 weeks.
Okay, and then there was a couple of other things going on, like her ears. Her ears do usually bother her around this time of year. And I know that kidneys winter, so maybe that has something to do with that, right? Kidneys winter time.
Yeah, yeah. There's a lot
But
that can be going on with the ears. And so
Okay, so she was scratching at them a bit. There wasn't like much of anything coming out. It just kind of like smelt a little bit off.
both ears or just one?
Yeah, both.
Okay.
And then her eyes were running a lot, and she doesn't usually normally have that either. And my question is, when I'm trying to figure out like what the issue is, like how do I know like that's all associated with the eyes or the liver, right?
Well, it depending, yeah, the eyes are the external manifestation of the liver, but the thing you can have a lot going on around the eyes. The eyelids are associated with the spleen. Again, the mucus coming out of it, that can be a spleen imbalance causing excess mucus, or it can be a dryness that's causing inflammation, which is triggering the mucus. I would sit there and think in Las Vegas that you guys would be struggling with dryness a lot. You know,
Right, so that's what I'm trying to figure out. Like, how do you know? Because I was looking in my Chinese medicine book, and it says like dryness, conjunctivitis, like all these different options of what it could be, and then like why it's happening. And I'm confused on like how you kind of figure out like what's liver draining, liver stagnation, liver blood, like.
yeah,
know?
that can be a little difficult. It takes a lot of experience. But the first thing that you do is you look at the situation. Okay, like for example, I remember working with a lady that her dog had skin problems. She lived in San Francisco. Lots of humidity there, so a lot of dampness in San Francisco. So in the area she lives, she's going to be struggling with dampness. Area like you know, down in Phoenix, Arizona, dryness, big dry. So you're fighting that as well. You know, when I used to practice down on the Cayman Islands, hot, moist, hot, damp, and so we had so many bad allergy patients down there that we literally had dogs that could not live there, and they had to ship them back to the UK or to the United States because the allergies were so bad just due to the climate. And so I would think that your dog certainly would be, I know you're focused on good food and what have you. So I would be, just common sense tells me that dryness would be my number one. And then again, wintertime is dry time. So you got dry time of the year, dry environment where you live. And so I'd sure be looking at dryness.
Okay,
Okay.
and then I can,
Yeah.
do you recommend any other, should I be giving her something else, or you think
I'd
just
be
stick-
watching. Yeah. What's her water intake like? Is she drinking more water? What are her poops like? Are they getting hard? Are they soft or what? So you're putting all these little pieces of the puzzle together. And you're looking at the tongue. What's the tongue? Is the tongue dry or is it wet? So you see what I mean? You're taking all these little clues and putting them all together. Dryness will often dry the mucous membranes. That's why the eyes start to get goopy. Coughing is real common this time of the year. When I saw a lady post the other day, her two cats, sweet little kitties, by the wood smoke fireplace, and I sat there and thought, gee, that's one of the number one causes of asthma in cats is wood smoke. And so, you know, when you look at things like this, you go, boom, those cats are going to end up having pulmonary disease because of that wood smoke. But that's the clinician in me. I look at things and go, oh, that's going to be it. So that's what I'd be looking at. But I would be leaning towards focusing on the dryness. Is this a dryness situation? And so like if I have somebody that calls me and says, my dog's coughing at night, and they're not sure about if it's a dryness or a dampness, what have you, then put a humidifier by it at night and see if it helps. And if it helps, then you know you're dealing with dryness. And so then
Okay, I have a good one. I have like the Dyson one, so I can put that more closer to her.
yeah, put it up. Yeah. Because if it is dryness, then just getting some moisture in that air is going to help that, especially with the mucous membranes. Mucous membranes have to stay moist. That's why if you go outside and it's really cold, That's why your
Yeah.
nose starts running and stuff, because your mucous membranes start to dry out.
Got it. Okay. Thank you.
So we have this, somebody else, we've got this other opposite sex that came in and snuck in behind us. You're supposed to be skiing. I thought you were skiing every day.
Yeah.
Every time I look on the computer, I see pictures of Truckee and ski images and what have you, just going down the slopes and everything.
Yeah, not every day. I actually was up there yesterday, but we'll be going back next week. But
Okay.
great to see you all, and just,
Great to see you too, Scott. Yeah.
yeah,
Cool.
like to keep informed here. I love this group, so
Well,
thank you.
Look who just joined us.
Oh, it's
Oh,
Brett.
Yes.
It's Brett.
He just
Is
came
that
in.
right?
He
Good.
came in, well, I carried him
Oh.
in and then he left, and then he laid down on the floor by the chair, and now he just went in the chair. Is so cute.
Aw.
So happy. So
Good
Dr. Thomas,
energy.
I know it is good energy.
So April, you know how I was
Right.
telling you about
Out of-
Donna for compassion, Sabrina for worrying, Hannah about food. If you needed anything about snow skiing, Scott's your man.
Yeah, exactly.
He's your
So that
man.
way people come to this group, but so I called the vet's office. Well, as soon as you said that, before they closed, and they said, well, it wasn't in your order, so we can't give it to you. And he's off for the rest of the week. So I said, can you have another doctor, like sign it for tomorrow? So maybe I'm gonna try and get in tomorrow. But as long as he's acting normal, are we safe for a week? Because we are leaving next week. We're gonna be gone for 4 nights. And I'm going to try and get him in tomorrow and then get some fluid in him, but I don't know if, how that's going to work out depending on what they do.
If,
I mean, do you
if,
think
if he's eating, then you should be fine.
he's eating because I'm giving him the methimazole or whatever, and
Oh, so you're using an appetite stimulant?
I
yeah.
am. I've been giving it to him once a week,
Yeah,
and
I would, if you can get some fluids in before you leave, I would.
okay. So in the methimazole, is that okay on his kidneys as the way that things are going?
Yeah,
with him?
yeah. Use it in a lot of
Yeah,
kidney patients, yeah.
At once a week, it should be safe.
It's it is so important to get food in those cats. So important. So yeah. I just
right.
forgot you were given an appetite stimulant too. So that kind of tweaks it.
I'm sorry.
Of course, when
I
we're
said
stimulating the
methimazole.
appetite, then we don't know what his appetite would be like without it.
I meant I meant the one that's the stuff you put in the ear. Yes, the appetite stimulant in the ear, metronidazole or whatever.
You're talking about
Metronidazole.
for the thyroid?
Antibiotic.
No, I'm giving him the thyroid drug, and he also told me that I should start giving it to him PM also, because I've only been giving it to him in the morning. But I'm talking about I'm giving him the appetite stimulant, the metronidazole, whatever. Is
Yeah.
that okay for his kidneys?
Right.
Yeah.
Right. And I
Okay.
have to say, when I looked at that blood work, the first thing that I thought about was probably bumping up the methimazole a bit.
Okay. So I'm going to start giving it to him twice a day.
Yeah.
See what happens.
And you're leaving when?
We're leaving Monday. We'll be back Friday.
Okay, so that if you bump it up, then you'll be able to see if there's any changes. But
I'm going to bump it up starting tonight, and
Yeah.
his person will be here that's super good, and we will only be 3 hours away. So if something happens, I can be home in a heartbeat.
Okay.
All right.
Yeah,
Thank
I
you.
know, been there, done that. One time, one of our cats crashed, and we were in Yellowstone, and it was a 8-hour drive, and it was like 2:00 in the morning. Because the pet sitter said, "Cat's crashing," driving as fast as we could.
Wow.
So anyway, so
Thank you. I didn't mean to hog up the time. I'm so sorry.
you didn't.
Okay.
So, Jolene, how are you doing, sweetie? She's fine. She left.
Here,
No,
she's right here.
I'm here. I'm just recovering from a bad cold, so that's why
Oh,
I'm
no.
my down best.
Hey, did you get a chance to listen to Cheryl's thing?
I just started to, yes.
Are you enjoying it
Yeah.
so far?
Oh, yeah, no, I love it.
Okay, good.
I love
Good.
it.
Good.
I just-
You're my guinea pig. I
very-
wanted to see how it was going to do with you. So good. Well, let me know how it goes when you get it finished.
Okay,
She's
yeah, there's
he's
quite a few
using-
CDs there.
Cheryl Richardson. Does anybody know who Cheryl is? Cheryl is a popular Hay House author, and does a lot of stuff with women's health. And she's a friend of mine, and I used to do some work with her. And she came out with a grieving audio thing about how to handle grieving when you lose a pet. And she told me about it, and she sent me a copy of it, which I haven't listened to, but John has got it, and so I was seeing how she was enjoying it, because it might be something that we might want to keep in mind whenever we lose a pet and need that help. So
Yeah, Jolene, have you listened to or heard it? I mean, I'm just asking because I'm still grieving, even though it's been a year and a half. It doesn't just go away.
No. I was who did you say have it? I was trying to track this conversation. I would be interested in listening to it as well.
her name is Cheryl
Cheryl.
Richardson. Cheryl Richardson. She's got a website, and that's on her website. But I know Cheryl, and everything that she does is really good. And I remember when she told me that she had done this, and I thought, well, that would be great for people that lose their pets. And I just totally forgot it. And then when Jolene lost her last pet, her dog, then I thought, that rang a bell. And I thought, well, let's just see how Jolene likes it, and go from there.
Okay.
It's in the chat.
Yeah. So anything else? I was going to talk about something, but it's already 6:30. We'll put it off to next time. And so anybody else?
One question. My dachshund, so every morning she's waking up with it's not all day, but it's just the sneezing is just the nonstop sneezing. And she's the 15-year-old dachshund. And I mean, I know that's very general, right? So I should take her to the vet, but any thoughts?
Well, sneezing, a lot of things can cause sneezing, but when somebody tells me my dog wakes up in the mornings and they're sneezing, then I sit there and go, okay, why is it only sneezing in the morning? Why isn't it sneezing later? Is there any nasal discharge that goes along with that? You see what I mean? Okay,
Yeah.
so what that tells me is that I'm thinking irritant. I'm thinking there's something that's irritating the nose. Okay.
Okay.
Instead of an allergy type thing or something, I'm thinking that it could be a contact scenario. It could be because when they sleep, they're sleeping in their bed. There's a lot of dust mites and stuff like that. So like a lot of people that have allergies to dust mites, they struggle at night because their head's in the pillow and the pillow's got dust mites, and then they get sinus things and what have you. So I would be thinking local. I'd be thinking what's going on, where your dog sleeps, what have you. I had a lady that contacted me one time. She had a cat sneezing, just just sneezing its full head off. And she kept going to the vet, and then they would try this and try this and try that, and it just kept sneezing and everything. And we started talking, and then she just happened to say it sneezes most of the time when I carry the cat around. And so you know what it was? She had changed perfume. And so the cat was reacting to the perfume, and every time she put it up on her shoulder to get a sniff of that perfume. And so it was a major medical cure. So
well, we have 4 dogs. The 4 dogs sleep in our bed. It's just one that's sneezing. But I'm gonna maybe I just need to throw away some pillows and whatever. So I'll inspect that.
Maybe if you run it through the wash or something. Yeah, see if that helps.
I'll do all of that. Okay, thank you. Yeah, because it's not during the day. It's not right now. She's fine. So
yeah.
Okay.
Yeah, I bet it's some kind of a local irritant to where she sleeps. Yeah.
Okay.
All right.
Perfect.
Anything else?
I wanted to offer, it's late in the conversation, but Melissa, when you were mentioning your dog that has a hard time going to the vet, and you're talking about she's a rescue dog and trying to guess what her story was, I was going to suggest that you let go of she's a rescue dog and she's had a lot of trauma Because, right, we don't know. We don't know. So that was yesterday's story, and today's another day. So
That's
as
a
long
great,
as, right, as long as you carry that story, you bring that expectation.
that's
in.
great. That's a great. I'm glad
You're
you
awesome,
said that, Dr.
Jolyn.
Lynn. That's
You're,
outstanding. Yeah.
I think I do that as a backup because when, you know, people, when I am trying to explain, like, I don't know, and okay, and this may back up to like when you go to a vet and then sometimes they just look at you like, well, what's wrong with this dog? Like, why? Like because there are some vets that like kind of look at you like, have you done something to this? It's just a weird culture now. And so I use that story because I'm like, this is a new dog to me and I'm doing everything I can. But you probably just hit something on the head
That's
too.
really,
Like it
that's
doesn't
really
have to be
cool.
the story behind everything I say every time I talk about this dog,
Yeah,
right?
yeah. And you guys have heard me talk about this all the time, you know, because I work with so many cancer patients. And I remember I told that lady a while back, I said, every time you look at your dog, you see a tumor with 4 legs. And you can't see your dog like that. Otherwise, you're going to project that on your dog. And that's what I was going to plan on talking today. If you guys
Thank
didn't
you.
have a bunch of questions, which you always do. But one of these days, we're going to talk about placebo and nocebo and how important that is. And everybody knows what we're talking about. Everybody knows has heard about placebo. What's nocebo? Anybody know what nocebo is?
No placebo?
Nocebo.
Oh,
Nocebo means if you're thinking negative, then bad things are going to happen. Placebo is like, I believe this is going to help me, so it's going to help me. Nocebo means if I believe this is going to hurt me, then it's going to hurt me. It's just the opposite, you see, and they both work exactly the same. And there's some tremendous studies out there that show how powerful that is when it comes to your health and your pet's health too. And I was thinking about this before I got on, and I was thinking because I thought I was going to talk about placebo nocebo, and I was thinking there's anybody know who Lynn McTaggart is from England? Lynn McTaggart is kind of a holistic type of practitioner. Have you ever heard of the Power of 8? We talked about this before years ago when we used to do guided meditations about she would get these groups of 8 together and do these meditations. But anyway, she wrote a book and she covered some of this placebo and nocebo affected, like Joe Dispenza. Anybody know who Joe Dispenza is?
Yes.
Joe Dispenza's got a book called You Are the Placebo. And the point is that there's a lot of scientific research out there that shows how important this is and how we manifest our perceived reality. And the perfect example, this was out of Lynn McTaggart's book. And she talked about there was a guy in Italy, and he was diagnosed with a terminal cancer. Okay. He was sick. He came in, they did a full workup on him. They said, you've got this malignancy and it's going to kill you. Okay. And so make your arrangements because you're going to die. And so he went home and and that's what he planted in his head. He's got a malignancy. He's going to die. So he started getting his ducks in a row. He was sick, getting worse. And then as fate would have it, about a month later, this same doctor that had been working with this guy read an article, a medical article that there was a new drug that had just come out that was specifically for this type of cancer, and it was having outstanding results. And so he called the guy up and said, great news, there's a new drug for this type of cancer you have, and these patients are doing really well with it. And so the guy put this guy on this drug, and he started feeling great. All the symptoms went away, and he started feeling great. Life was good, back to his old self. The drug worked. Okay. So what happens? About a year goes by, and the same guy the doctor that read the article reads another article that they've done follow-up research and find out that drug really doesn't work.
Yeah.
It really doesn't work. Now that they've done full studies and the government's involved in everything, and say, no, it really didn't work. So what does he do? He calls his patient back up and said, I got bad news. Bad news is that this drug, they find out that it really doesn't work. And so anyway, immediately he starts feeling bad again. He starts feeling, and then what happens? He dies. He dies from the cancer. Okay. Now, it doesn't stop there. The interesting thing about it was they did a post-mortem examination on him. No cancer. No cancer.
Oh my gosh.
Imagine that. Imagine the power that the mind has with what it believes and what it doesn't believe. Think about the person that has multiple personalities. Everybody's heard about people that have multiple personalities. One of the personalities, when they're in that personality, they've got insulin-dependent diabetes. So they have to take insulin injections. When their mind shifts to the other personality, they don't need insulin.
That was amazing.
Wait.
That's not just one person. That's many people out there. So that just shows you the influence of the mind on the body, because the body is a direct reflection of the mind. 100%. 100%. Keep that in mind. Keep that in mind. You are what your thoughts are. You are what your perceptions are. And your whole reality is based on your perceptions and your beliefs. It's a fact. This is not voodoo. This is not. And it has a major, major, major influence on all of your reality. Okay? And we could go into more detail, but I wanted to plant that seed because it's so, so important. There was an article that I remember reading, an article a few years ago, and where neurosurgeons and orthopedic surgeons admitted to this person that was doing this article that they depended on the placebo effect for dealing with postoperative pain, that they absolutely depended on it. And this goes against all of everything in Western medicine. They could have lost their license for agreeing to this. They prescribed medications that they knew the only benefit that they were going to have was the placebo effect.
Wow.
That's how powerful it is. And the same thing goes for the negative thing. And you've heard me talk about the seizure lady. Oh my God, I'm going to have a seizure. Boom, she has a seizure. This isn't magic. This isn't black magic. This is real, just like gravity. It's real, okay? And we have to start using it in our favor. Okay?
Dr. T, I think Kiki believed in your Chinese herb that you recommended to him. And he's like having a placebo effect and he's not having any seizures.
Good. That's what we want. Okay,
But
so
you
whose belief is making Kiki not have seizures?
All
His.
of ours.
Yes.
Well, it's down to two people. It's either Sabrina or Bree, one of the two.
Speaking of multiple personalities.
Oh,
There we go.
that's right. Multiple personalities. All right. Okay, great. All right. Well, I'll leave that with you.
Thanks,
Anna?
Dr. Tillman.
Thank you.
Showing up.
Everybody.
Yeah.
See you all.
It's great to see everyone.
Namaste, everybody.
everybody.
Namaste.
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 Great having you with us, April.
Thank you, April, for
Thank you.
joining
Yeah,
us.
This
thank
has been
you too.
wonderful.
If you have
I'm
any questions,
so
send them
grateful
to either
balance.
Sabrina or Bree, one of the two.
Okay.
All right.
Available at all
Until then,
times.
Bye.
Don't
You
worry.
guys have a great evening. Bye.
You too.
Good night, everyone.
Bye-bye.
Good night.